Good afternoon, good morning, and good evening to everyone. We welcome you all, particularly those of you joining from far away and at late or early times. Thank you for joining this WHO EPI-WIN webinar on Wednesday on the topic of preventing epidemics and pandemics through One Health in practice. Voices from One Health professionals, hosted by WHO EPI-WIN team. We would also like to welcome Dr. Maria van Kerkhove as our new acting director for the WHO Epidemic and Pandemic Preparedness and Prevention Department. And wish her all the best in her new position. For those new to the EPI-WIN team, this is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergency. With these EPI-WIN webinars and associated EPI-WIN Digest, our goal is to translate science in accessible, understandable, and relevant ways for evidence-informed actions and decisions in health emergency preparedness and response. Today, we have a great panel who will share a variety of perspectives from different parts of the world on what One Health means in practice. Dr. Maria van Kerkhove, Acting Director at the Department of Epidemic and Pandemic Preparedness and Prevention from WHO, Dr. Catherine Machalaba, Senior Policy Advisor and Senior Scientist at EcoHealth Alliance in the United States of America from New York, Dr. Mirna Kai Cunningham-Kine, who is a medical practitioner in Nicaragua, Mrs. Chane Sui Lan, co-founder at Kaosang in Cambodia, Mr. Madi Savadogo, co-founder and general coordinator for Rabies Free Burkina Faso in Burkina Faso. The session will be moderated by Letitia Sieffert, technical officers in the Department of Epidemic and Pandemics Preparedness and Prevention in WHO. Now, some housekeeping. This webinar is being live streamed on the EPI-WIN YouTube channel. The webinar is being recorded, and afterwards the recording will be available from our website. The address will appear in the chat. Interpretation is available today in French, Spanish, Arabic, and Portuguese. Please go to the interpretation globe icon to access and select the language. We also have artificial intelligence interpretation in Russian, Chinese, Hindi, and Swahili. We invite you all now to post your name, location, and organization in the chat box. We would love to hear where you're joining us from. And then please add any questions you may have to the Q&A box. We can more easily keep track of your questions. So without further ado, I will hand over to Maria van Kerkhove for the welcome to this EPI-WIN webinar.
Thank you so much, Agnesi. Thank you very much. I'm particularly pleased to join this EPI-WIN seminar on my first day as acting director of this incredible department. And I'm really pleased to see so many people joining this particular webinar, but also for all of you who have been joining our One Health series. So as a reminder, our EPI-WIN webinar series covers a range of emerging infectious diseases at the animal-human interface. With our One Health series launched last May, we're covering and unpacking some of the critical aspects of the One Health approach. As you may know, the day after tomorrow, on the 3rd of November, we will be celebrating One Health Day. And although this is not an official WHO International Day, we thought it is a good moment for us to celebrate this and to convene this webinar. So today, as you've heard, we've arranged to hear voices from One Health professionals from around the world who are working on preventing epidemics and pandemics of infectious diseases. You will be listening to the diversity of profiles and experiences in the field, and we have today with us a rich panel to explore the breadth of One Health implementation. But we also want to hear your voices as an audience, and I can already see the chat quite active, but please do use that Q&A tab down at the bottom and pose your questions, and we'll be trying to answer as many as we can today. So this session will be particularly interactive. We want to hear your perspectives, your words, your experiences, and we'll assemble those together in creative ways. One Health is an approach that is implemented through multiple sectors, multiple actors, multiple partners, and after all, multiple people. Learning from personal stories and experiences of people working to prevent epidemics and pandemics can leave a profound mark on all of us that will influence and inspire us. Personally, for me, I reflect often on the time that I spent in Cambodia. I lived there for almost 2 years, and everything I know about One Health, I learned in Cambodia. And I'm very happy to have someone from Cambodia on the panel today. So thank you very much for that. But I often reflect on my time there where the animal health sector, the human health sector work together, learning to work together, but seamlessly, to really understand the importance of working together to prevent mitigation, the spillover of these pathogens that have epidemic and pandemic potential. My experience was in H5N1, but I reflect often on the work from the animal sector, the work of the village chief, the work of the village animal health worker, of the community health workers, of the different CSOs that were there, of the different institutions that were working there, and particularly Institut Pasteur with the Ministry of Health. And really, this is where I learned how to work in a multidisciplinary collaborative approach. But I don't need to remind you of the challenges that we face when outbreaks happen, when we can't prevent them, and when these outbreaks become epidemics and pandemics. And right now we are experiencing pandemic fatigue, which is completely understandable given the trauma that we've gone through for the last 3.5 years. For us at the World Health Organization and with our partners across the quadripartite, we know the risk of epidemics and pandemics is only increasing. It is not a question of if, but when. So we are constantly working with our member states and with our partners around the world to ensure that the gains that we have collectively made, particularly over the last 3.5 years, but starting well before COVID, are sustained and used to prepare and prevent the next pandemic. In this context, I want to challenge you with the following questions to explore how One Health can help us find solutions, synergies, partnerships that can help us better to prevent and prepare for future outbreaks and pandemics. How can we turn this fatigue and these lessons that we constantly learn from past epidemics, including COVID-19 pandemic, to transform this narrative? How can we truly help to address pandemic risks for the future? So I'm really pleased that we have this incredible panel that has been pulled together, a panel of champions who share some of their experiences, solutions, and findings. So let's hear from you on the panel. Let's hear from you in the room, and we find our common voice so that the implementation of One Health can reach greater heights, helping us to better detect, prevent, prepare for emerging health threats. So I thank you all for joining this important conversation, and back to you, Agnesi.
Thank you, Maria. Thank you for this amazing welcoming. So since this session is meant to celebrate the diversity of voices, we really want to hear from all of you in the room. My colleague Supriya has shared in the chat a link to a Slido. So go to slido.com and put in the code. It's like 1098543. It's also shared in the chat. So please follow the link and log in. And no rush, you have 5 minutes to provide your answers. And in the meantime, my colleague Letizia will ask the same question to our panelists. If you face any issues, please write in the chat and my colleagues will be there to assist you. Thank you very much. I now hand over to Letizia, who will moderate the session.
Thank you very much, Agnesi. So as you can see, you have the link here on screen. And so I would like to turn to you first, Dr. Mirna. You're a medical surgeon, an Indigenous rights activist. You have also served as the chairperson of the UN Permanent Forum on Indigenous Issues. So we would really like to hear from you, what is your definition of One Health when it comes to epidemics and pandemics, preparedness and prevention? So, just in a few words, we will just do a quick tour de table. Thanks very much. Mirna, over to you.
Thank you. Thank you. For Indigenous peoples, health and One Health is equivalent to the harmonious coexistence of human beings with nature, with themselves and with others, aim of a well-being in spiritual, individual, and social wholeness and tranquility. This health concept articulate physical, mental, spiritual, and emotional elements from both individual and communal points of view, and involves political, economic, social, and cultural aspects. There cannot be one health and well-being if our collective rights, such as rights to land and natural resources, and to conserve our natural resources, are not ensured. Thank you.
Thank you very much, Mirna. So I wanted now to turn back to you, Catherine. You're a principal scientist at EcoHealth Alliance, but you also are a member of the One Health high-level expert panel. So what is your own definition or keywords?
Thank you. Well, we have an OLEP definition that I will put in the chat, but I think it really comes down to understanding the problem comprehensively, understanding the relevant actors, how they're impacted, and then the solutions, really that comprehensive view that we don't gain if we don't have a One Health approach. So working together to really fully understand and act appropriately to minimize the costs and also really maximize the benefits. Thank you.
Thanks so much, Katrin. And now moving on with you, Chani. You work very closely with the Cambodian communicable disease control, and you have a real expertise in leveraging technologies for empowering communities. So what is your take on this question?
Thank you, Leticia. So similar to our other previous speakers. So from my point of view, there's One Health is about the collaborations between the human animal health and the environmental health. We're looking at both professional collaborations, and also one important also is the community participatory in working together to ensure that we detect and then responding to any outbreaks as we're living in one ecosystem. Thank you.
Thanks so much, Annie. And lastly, coming to you, Madi, and taking the advantage of our interpretation in French, I will ask it in French, the question. So, vous avez fondé, Dr. Madi, l'ONG Rabies.
So, Dr. Madi in Burkina Faso, working at the Ministry of Agriculture. What is your answer to this question? Thank you very much, Leticia. So first of all, it's a pleasure for me to share our experience. And I don't want to repeat my colleagues, so I would say that One Health for me is a cooperation work. Cooperation work between many disciplines and domains, but also to include the key stakeholders to allow us to reach optimal health. And to provide so One Health has 3 dimensions: safety, discipline, but also the territories. And all these 3 dimensions are going to be adapted to face the challenge that we have to face. That's how I would define One Health. Thank you very much.
Excited to discover the response from our audience as well.
Thank you, Leticia. Thank you all for your contributions. Let's see what we have. Supriya, are you sharing?
Give me a second.
Otherwise, I can share the results.
Yeah, there you go.
Oh, wonderful. Thank you all for your contributions. Let's see. So we have like collaboration, like One Health is seen as, by many of you, as collaboration, as a multidisciplinary approach, as a holistic approach, a multisectoral program. And I see holistic several times. I see also words like resilience, or like still again, teamwork, collective health, surveillance, interdisciplinarity, transdisciplinarity, transsectorial, multisectoral. It's amazing to see all these inputs from the public. And so now let us please also keep the slide link handy, as it will be used again at the end of the session again, so we will ask you another question. But now let's dive in the panel discussion. So Leticia, please go ahead.
Thanks, Agnese. So yes, we now have a better understanding of your field in the audience, and now with our esteemed panelists on some of those definitions and what it means for each of them. So now we've asked each of the panelists to share a very concrete example of their own experience of what they have been working on in One Health. So we'll have also a couple of slides that we will be sharing with you afterwards. So maybe let's start with Madi. Nous avons hâte d'entendre votre expérience, and surtout avec votre,
we want to listen your experience, Rabies Free Burkina Faso.
And I think you'll also be sharing your slides. We are seeing them now. That's wonderful. Thanks.
Thank you. Thank you very much. So we have different definitions here, and we see now that we have a common goal to make a synergy between animals and humans, of course. In Burkina Faso, we have a small experience that I would like to share. We have an associative platform specialized in combating human dog-mediated rabies. And today, I would like to share so in Burkina Faso, I don't know if you have heard about it. It's a country very rural. We have 70% of dog biting animals positive to rabies, and connection is breaking. So in terms of the actions implemented in Burkina Faso, have led to the creation of One Health national platform, and we have this is a coordination unit between the different disciplines and stakeholders in this domain in the country. And within this framework, and knowing that Rabies has been a priority in our country, within this framework, our association was created in 2001 to focus, to center in fighting back this disease, to implement the models and address this public health issue. Overall, our association it has a principle to promote health, to observe the problems, to acknowledge that there is a link between human health, environmental health, and animal health. So within this framework, we implemented this platform, gathering many profiles. We have students, apprenticeship working with us, but also healthcare professionals. Also, we have all the disciplines in the human health domain of animal health. Connection is breaking. And we're focusing in communication and economics. We gather all stakeholders so that we can properly tackle this health issue. Now, our interventions on the field are articulated on 4 pillars that I'm going to discuss after. The first pillar is controlling the animal-based diseases. So with the different skills that we have, what are we doing? Well, we know that the best way to fight back this disease is vaccinating animals, vectors of transmission of this disease. So we have organized vaccination campaigns, but also we have suspicion cases. We identify them quickly in cooperation with the laboratories available in the region. Connection is breaking. We need to manage risk. In this case, when someone has been bitten, our association manages the person by vaccination, and we have many things to take into account. First of all, the confirmation of from the laboratory, the identification and control of the animal, and then in terms of vaccination, provide affordable and accessible vaccination to the people who were bitten. And then identification. Identification is very important when we want to control, because this is a public health threat. So we have trained professionals, healthcare professionals, to update the knowledge of this disease, and we're in line with the new recommendations by the international institutions and the government. So through the different sessions and awareness-raising sessions, we strengthen the capacity building in this regard. It is also important to highlight the opportunity that we have of working with the media and the social media. We use these social media platforms to disseminate our information nationwide because it's incredible, but in our country, even in the most isolated areas, we have access to internet. So today, population has more access to these social media and mobile technologies. Then, lastly, research. It is important to support all the activities we're doing with research workshops. Why? Because it's important to get the data to feed the strategies and the national policies to advocate, because this is going to be this will be the leverage for the government to take our input into account to draft the policies. We need to understand and get data to know what model has to be pushed forward, not only for our country, for rabies control, but for other public health threats. That's why research is very important to push forward in this regard. And to sum up, this is the key takeaways. First of all, today, the role of the civil society is essential to fight the outbreaks of the disease, but also working with the media, with social media, to boost communication on our activities so that everyone can be informed of the risk and what to do when facing a risk. Lastly, we should use all our means to start our intervention. Connection is breaking. Then we need to move forward little by little, step by step, to reach our goals. But at the very beginning, what's important, we need to have a large vision that will allow us to change the mentality of the population, because that's important. We need to work so that the living conditions of our populations can be improved. We must live in a world free from diseases. Connection is breaking. And we need to advocate to promote good health practices, and we'll have the opportunity to discuss with my peers. Thank you very much. Thank you, Madi, and thanks for this example highlighting your communication vaccination. Thank you.
A very interesting field of technology and data. So very interested to know how you're applying this concept of surveillance at the human-animal environments in TFFS. So over to you, and I think we will have the slides being shown on screen very shortly. There we go.
Okay, thank you, Lalita. So for my team we're from Cambodia, social enterprise named Kosang, formerly named Instead iLab Southeast Asia. So our project that I'm going to show today is about event-based disease surveillance in Cambodia. Next slide, please. So our team have worked in Cambodia since 2009. But at the beginning, we worked mostly close with the Ministry of Health, supporting on the disease surveillance using the digital system. And in 2009, that's when we are more like looking at now how might we support in terms of One Health in Cambodia. And that's with the opportunity that when we got a support also from ending pandemics, that allowing us to work with both of the Ministry of Health and Ministry of Agriculture in looking at supporting in the event-based disease surveillance for both of the human and animal health. Next slide, please. Yeah, so this is lead to the event-based disease surveillance, where this is something new because of usually the information or data recording is not systematic previously on the even outbreak, and the data sharing also is more like informally. So what we work in here, we spent about in the first year working very closely with both of the ministries and also co-designing the solution with them, and with the support also on the technical support epidemiology from the ending pandemics team. So with multiple rounds from prototyping and testing in the field, and then getting the feedback to the ministries and refining it. So what the result coming out that is the in 2020 that we roll out the this digital system event-based disease surveillance for the Ministry of Health, and in 2022 is with the Ministry of Agriculture, with the animal department. The delay due to COVID interruption. But all in all, this is the both ministry using the same digital system for recording and tracking of the disease outbreak in human and animal in Cambodia. And the deployment has been to all the provinces in the in Cambodia. The important part about this is the system is that designed with the ministries. It's used the milestone and metrics, as we can see here. The milestone and metrics from the detection of the event to the completion of the event close. So this is providing also in terms of like the monitoring, tracking, and supporting coordination between the national and the provincial level. This is something new, and it's there's more to improve also, and to move on more in the future as well. But it's very exciting. Next, please. Another important aspect, I think this is very exciting, is that both of the ministry agree to share the disease they record in a digital in the same system. So any event, when any event that is recorded, reported from the field related to the 5 disease of the on the animal part, on the animal side, like H9N2, H1N1, leptospirosis, anthrax, or rabies, it will automatically share with the human health, and this is built-in automatically. Agree or already upfront, and both agree to share the data. And the same thing for the human health. They agree on the sharing of the 8 infectious disease with the animal health. And this is something that we're talking about, the data sharing, the speed of the information is important when it comes to the infectious disease, when it comes to outbreaks, and this is one of the important steps in Cambodia. Yeah. And next, please. Next slide, please. So the system provides also in terms of like the data visualization to the decision maker on both of ministries in monitoring the case in the country. And I didn't put the screen. Another important part about it, it also included the media monitoring, which linked to the medicines. That media monitoring allowing the ministry to monitor the news locally and regionally on particular disease or keywords. So this is also kind of supporting on the information providing to the ministries. Yeah. So so far we have since the deployment, so we have there are about 315, more than 315 outbreak that have been recorded and tracked on the system. And there's more to go in the future. We hope to also onboard with the environmental counterpart very soon as well. Thank you. Over to you,
Thank you very much, Jenny, and yeah, thanks for sharing like something very concrete and using data visualization and data sharing. That's really insightful as we give the floor to several voices of One Health. So now moving on, Catherine, very excited also to hear about one of your most striking experiences, both in your role at EcoHealth Alliance and OLEP. So yeah, over to you now.
Thank you very much. And I think the slides are just coming up. Thank you. So I really want to emphasize that context is very important. And so each case I think looks very different, but there are some common themes. So I really appreciate the prior presenters, and to see these great examples of One Health in practice. I think they're all very encouraging, and I think we should really celebrate those and see how we can upscale them. So if we can go to the next slide, please. I want to highlight this case study of a One Health approach to reduce the risk of Rift Valley fever. And this is specifically the context of South Africa. There was unfortunately a very devastating outbreak in 2010 and 2011. There were human cases, there were a lot of animal cases, and there was a really severe livestock industry impact in terms of economic livelihoods. If we think of nutrition, if we really think about the downstream impacts of this outbreak. And so we want to be prepared. We really want to be reducing the risk. And over the past 9 years, we are now in the 9th year of the study, we have been working to take a One Health approach. There are many partners involved in this. You can see the logos here of some of the partners, but through this project, we have been able to mobilize this One Health network of stakeholders and partners. And I think that this is a real success story in terms of both the research, which is very robust. There's this epidemiological component, there's the ecological component, there's the human behavior, really the decision making and incentives and economics component. But you can see really all of these different components on the screen here. We were able to add in soil and vegetation monitoring. I think these aspects that we don't immediately see when we start a project sometimes, and by having stakeholders at the table and really leaving the space for stakeholders to come to the table to understand the problem more fully, I think it's really shown us the complexity of a disease like Rift Valley fever, but also the importance of working together to really understand it, to really take action. And I think it's really exciting. I hope that networks like this, we will continue to see them develop and have more partners at the table when we have the discussions, when we can really interpret the findings together and identify further questions that need to be answered by research and practice. I think that the readiness too, that then if there is an increased risk of Rift Valley fever, now the networks are in place so that information gets from the early warning systems to the stakeholders that can really use that information to vaccinate early, to work with farmers so they're aware of the risks, to also work with veterinarians who are highly exposed in the profession. So I think this opportunity of a One Health approach to bring together stakeholders, leave really the openness for additional stakeholders to come under that One Health umbrella, really play a role. We have really learned a lot from this project. And I think that others taking a One Health approach to Rift Valley fever virus, they may have similar stakeholders at the table, or they may have others too, based on their the context that they're working in. So I'm happy to share the materials that we've developed from this project, but we can just briefly go to the next slide, just to reinforce how important context is. If we're looking at a different objective, so in this case, One Health to reduce human-wildlife contact, we know that there are disease risks from this contact, both to animals and to humans. We know that there are really large-scale environmental changes, really extractive practices that are unsustainable, that are also putting humans and animals at risk. And I just want to reinforce here, and this is some work in Liberia that we have been involved in with our partners. I think some of our partners are online here. I really just want to celebrate again the champions from many different sectors. So wildlife conservation, forestry, the ranger workforce doing their part to really help reduce this risk to humans and to animals. And I just want to celebrate these efforts and say we need to keep broadening the tent. We need to bring many stakeholders in. If we go to the next slide, just to briefly conclude, at the end of the day, and the next slide, please, just to show that it's important about context again, and that reducing the trade-offs and the co-benefits when we think about something like a One Health approach, it allows us to really understand the problem more fully. It allows us to bring in the right voices and make sure we're not leaving anyone out from that crucial decision making. And I will put in the chat the link to the OLEP prevention white paper that we developed, which includes some impact indicators, thinking about what do we need to do to reduce risk? You know, what does that look like? How do we monitor that, both at the starting point, but also over time to make sure we're not leaving anything really important out? So these are something, you know, we could imagine something like the number of stakeholders involved in risk reduction, mapping of different spillover interfaces, and then really the design and implementation of very practical risk mitigation measures, whether it's community engagement and risk communication, whether it's incorporating disease risk into land planning, and then really livelihood interventions, workforce development, all of these different entry points that we really need to be working together. Again, thinking about the trade-offs and the co-benefits, finding the solutions that really work and will have the intended effects and the optimal benefits. Thank you so much.
Thank you very much, Catherine, and thanks you also for highlighting all the environmental drivers and that dimension. So now, lastly, to you, Dr. Mirna. So if there's a couple of examples you would like to share with us, and really one voice that you would like to emphasize, so what would it be? Thanks, and over to you.
Thank you. I will share. I've seen so many cases of One Health approach during my over 50 years as health practitioner among Indigenous communities in my region. But I will share the experience that we had during COVID-19 in Latin America. When Indigenous peoples began to see the increase of the cases affecting their communities, and there was very little answer from the ministries of health, they all came together and organized with the Fund for Development of Indigenous Peoples of Latin America and the Caribbean, with FILAC, a platform with more than 50 indigenous organizations from the 19 countries. And the idea of the platform was to begin to, since the FILAC is an intergovernmental organization that has relation with governments and with indigenous peoples, what we agreed is that the platform would disaggregate data, would try to get data disaggregated from the different countries to know exactly how it was affecting indigenous peoples. We would promote from FILAC that the ministries of health adopt different guidelines that address indigenous peoples. And at the same time, we began to document what indigenous communities were doing in their communities to face the problem. We were able to register more than 100 experiences. And one of them that I would like to share today is the Siecopai. The Siecopai is an indigenous community that share, they are a transboundary peoples. They share Ecuador and Peru borders, and they have been historically, in the last century, expelled from their territories, especially from the area where their spirits that protect them live. So when they got their first cases of COVID, the communities went back. They took all of the elders to the islands where the spirits that protect the communities live and where they have traditional medicines. So they were able to gather traditional medicine and use the traditional medicine for the ones that were already ill, but also to protect the elders and protect the rest of their communities. They also took some of those medicines and took to other indigenous nations that live, communities that live in the Amazon basin. Now, after COVID, what they have done is that they have continued their struggle for their land rights and to be able to go back to their territories. Because for the Sekopai and for all indigenous peoples, land territory is important, not only because it's their ancestral territory, but because in those territories is where they have their traditional medicine, where they can perform their ceremonies, where they have access to their traditional medicine. So through the platform, that is something that we also promoted. And for example, an American Health Organization was able to define some specific guides to address COVID for indigenous peoples. Some of the governments in the regions began to disaggregate data, so we gather information. Some of the indigenous organizations set up their own areas to disaggregate data to know exactly what was happening. And we also saw that some of the ministries of health defined specific data to address the issue of COVID in a culturally acceptable way. So after COVID, what we're doing is that we continue promoting the organization of intercultural health systems in the different countries. We are continue promoting traditional medicine as a way to really address the issues of indigenous peoples and their health system. And we are also accompanying indigenous organizations that are continue advocating for their land rights. Because for indigenous peoples, One Health means territory, traditional medicine, and public policies that are intercultural and respect their own culture, but also articulate them with the rest of the health system so they can receive both health systems. Thank you.
Thank you very much, Dr. Miana, and for sharing this perspective on the indigenous people's rights and indigenous health as well. So we have a lot of questions in the Q&A. Thank you very much for this, and I would like to start with some specific questions. So turning to you, Maddie, on the rabies, if you can share with us whether that's a preventable disease, and can we achieve actually a rabies-free status? That was the question. And then also turning to you, Chani, on the if you could just explain a bit more about the tool that has been used in Cambodia. And then to wrap up, we'll ask Dr. Mirna and Katrin more about how we can actually also break down the silos. So if that's okay, then we'll start with you, Dr. Madi.
Merci bien. Thank you very much. All right, so the question is very interesting.
Your voice is breaking up, Madi. Yeah, please, can you start again? Yeah.
Hello?
Oui, c'est bon. Ça va.
Yeah. Yes. Okay, so the question, is it possible to completely eliminate rabies or to mitigate it against? I think it's very important, a very important question. So in order to eliminate rabies, there have been a lot of countries in the world who have actually achieved elimination of rabies. Some countries in Europe, in North America, but in the countries where it is endemic, what is lacking is the problem of investment and proper investment in the right places. You have to put the resources where they're needed so that we can vaccinate the animals so that people who are bitten can be treated in time, and also make sure that the community knows what they need to do whenever they are exposed and what they need to do in terms of vaccinating animals in the communities and knowing what to do, because then if somebody is bitten, then they'll also be protected against the disease. So we need to make sure that the authorities are providing resources to actually and effectively
Nadia, I'm
combat
turning
the
to
disease.
Chani
Thank
with
you.
regards to the questions on the tools you've been using in Cambodia.
Thank you, Leticia. So the tool has been using in Cambodia from 2020 for the Ministry of Health, and 2022 officially used with the GDAF, with the animal health in Cambodia. So it's been like rolled out to all the provincial health department and animal health in the 25 provinces. The important part I want to bring talk a little bit by in terms of like this digital system is we quite spend the first 1 year in designing with both of the ministries to ensure that we're capturing the context, because of the human health and animal health, the flow is not exactly the same. So we need to be actually understanding that and making sure that we provide designing the system that accommodate to the flow inside the ministries. And another important part is also to ensure that in terms of like what we are doing, whether that's usable or not in the field, that is a very, very important aspect, not just about like the agreement at the top level, but in the end, if the field doesn't use it, mean that we don't get any quality of data. Everything is depend on the entry point of the community in that monitoring and recording the report. So we validating the design at the early stage. We went to the field to assess the capacity, to see the infrastructures in there. Is a computer, is there internet access, what level can they use it, whether they can understand the design of the tool that we are about to create, and that allowing us to adjust at the early stage multiple times before we actually roll out the trainings to the province. I'll leave
Thank
it
you.
here. Yeah.
Thanks very much, Annie, for those details. So now turning to Catherine and you, Mirna. So maybe Catherine, on the the examples of multi-collaboration and breaking the silos. If you could maybe choose one sector that you've been successful. And then Mirna, I was thinking maybe elaborating on this silos thinking. So and on breaking those, what are maybe the conditions for Indigenous peoples to be successfully integrating in the project. So I'm breaking down a bit the questions that came through the chat. So Catherine, maybe over to you, and then Mirna.
Yeah, thank you so much. I think that we are really seeing that making coordination routine, collaboration, coordination, communication, capacity strengthening, the 4 C's, really the ingredients, the practical tools that we need to really scale up. We need to make these routine so that they're there during outbreaks, but also before outbreaks to prevent outbreaks, and really that day-to-day understanding of risks and how to address those risks optimally. I think that's a real opportunity to identify those entry points. And that's, to me, which sectors are we missing? What are their constituents? What are their priorities and needs? Where can they play a unique role? I would just give the example in terms of protected area management. We know that there's sometimes interfaces for human and animal contact. We know there's change in these areas sometimes now with deforestation, for example, or hunting. I think understanding really that context, working with the local workforce there, rangers, local community members, really, seeing who can play a role in understanding risk, where that reporting needs to happen. Are those lines of communication, those wonderful information systems that our colleagues shared, are they in the protected area, for example? Is that established? And I think we see often there are gaps, but there are real opportunities to develop those coordination mechanisms. And again, it's about bringing more resources to the table. And that's not always, and I saw this question in the chat, it's a really good one about mobilizing resources. It's not always financial resources. We need, of course, investment in prevention, but we also need the expertise. We need the day-to-day, who's on the front lines, and that really varies again by context. So making coordination routine and really finding those entry points to involve the key stakeholders. Thank you.
Thanks so much. And Dr. Mirna, I would like to also compliment.
Yes, from the point of view of Indigenous peoples, we have to address the structural barriers, and we have to adapt a human rights-based approach. when we look at indigenous peoples, we have to recognize that they also have collective rights, not only individual rights. So if we really want to break the silo, we need to address and relate with indigenous peoples who are the ones that have conserved nature. They have protected biodiversity, and listen to them. The first thing that we're saying is that the model of development is the one that is producing this type of problems. If we continue with deforestation, if we continue with an extractive model of development, of course, we will be affecting nature. And of course, we will break the balance, and we will have more of this type of disease. So I think that's one of the areas that indigenous peoples have tried to address through our own, promoting our own model of development that is respectful of nature and respectful of the balance between all of the beings and human beings and the rest of beings that lives in nature. And the second approach is that we are promoting our self-determination. And for example, I live in Nicaragua in an autonomous region. As an autonomous region, we have created and developed our own model of development, our health system model that combines traditional medicine with Occidental medicine. It includes all of the knowledge holders. It includes traditional medicine, and we bring that knowledge to the health system and reorganize the health system in a way that it's respectful of the way in which we have addressed health over generations. And this can only be we can only do that because we have the recognition of autonomy, of self-determination. We can bring all of the sectors together and sit them around the table and define how we are going to address the other issues that impact on health. So if we do not change the way in which the governance system of health in our countries, if we continue looking at health only from one sector and not in a holistic approach, it will be very difficult to break down the silos. We need more and of course, disaggregated data is one of the important aspects. You cannot define intercultural public policies if you do not have disaggregated data, because then you do not know exactly what you are focusing on and why.
Thank you very much, Dr. Mina, and thanks for reminding us that human rights is really also the foundation and prerequisites of this One Health approach. So with that, and really thanking you all very warmly, we want to turn back to the audience. So Agnese, back to you for a little last co-creation exercise.
Thank you, Letizia, and thank you to everybody for these interventions. It's amazing. So there is one last thing that we would like to ask you, that is to share with us how you say One Health in your native language. So for this, please open again the Slido with the link provided in the chat. And while each of you writes your answer, let me turn a last time to our panelists. How would you say or describe One Health in your native language? So first, let me start from Mirna.
Asla laka. I would say asla laka, kupia kumi, our alsut iwikabia. If we are united in one heart and we really live united, we will have one health. Asla.
Wonderful. And then let me pass. Which language is this, Mirna? Sorry.
This is in Miskito. In Miskito.
Miskito. Wonderful. And then I ask Chane to give us her version in local language.
Thank you. In Khmer, the language in Cambodia, say Sokopip Tai Mui.
Oh,
Yeah.
wonderful. Thank you, Channe. And then I ask Madi. Madi, je pense que la question est claire. Est-ce que vous pouvez dire dans votre langue
Bon. Ma langue
In
maternelle, c'est le moré.
my
C'est le moré qui est
my native language is
parlé
More,
dans
that's
la langue
spoken in my region. So I would say
Oh, wonderful.
Asie Imbre.
Merci, Madi. Et puis, Catherine?
English is my native language, but I would just say working together. Thank you.
Working together. That's amazing. That's the one we all understand. But it's amazing to see this variety of languages. Now, let's see what is the results on screen. Supriya, are you able to share? Let me see. Oh, here we are. Oh, I see that there is a majority of English speakers, One Health, and French speakers, un sol santé. And I'm then una salud in Espanol. Unfortunately, I cannot read all languages. I think our speakers helped me a lot with their way to interpret, to read the different languages, to have more variety. And I would like to close the webinars with a greeting. So as we're coming to the end of our allotted time, I will wrap up by saying thank you very much to all our speakers today, our interpreters, the WHO colleagues who have worked on this webinar, and the EPI-WIN team in particular, Supriya Besbarwa, who is our team lead, myself, Zhongfang Liu, and the team Nguyen, overseen by Dr. Maria van Kerkhove. Finally, thanks to all of you for coming and for your questions. We have shared the link to a WhatsApp group that you can join if you wish to continue to the conversation with each other. The recording of this webinar will be available at the EPI-WIN website. And if you want to keep updated on future EPI-WIN webinars, recordings and presentations, and the EPI-WIN Digest, please subscribe to our mailing list. Both links will be appearing in the chat. We hope you will join us for our next webinar, which will be on November 22 at 1 Geneva time. Details will be provided shortly on our website and through the mailing list. Thank you very much.